As we age, our bodies are like a clock that has run for many years, beginning to emit tick-tock sounds signaling changes. Bones become more brittle, joints less flexible, muscles gradually weaken, and balance is no longer as sharp as before. Many elderly people often complain about back pain, knee fatigue, and sometimes even a small slip can lead to a serious fall. In fact, by paying proper attention to posture when sitting, standing, and walking, older adults can completely maintain their flexibility, prevent a range of bone and joint problems, and protect their quality of life. Correct posture. It may sound simple, but it is the golden secret that helps older adults live healthier every day. It's not just about standing nicely, sitting properly, but is closely related to overall health. From the stability of the spine, the smooth functioning of the joints, to mood and confidence in life. Many studies have shown that long-term poor posture can compress nerves, reduce blood circulation, increase the risk of spinal degeneration, and even negatively affect the cardiovascular and respiratory systems. When sitting, if the back is hunched, shoulders are raised, and the head is bent close to the screen or book, blood circulation to the brain will be difficult. Pressure will be concentrated on the lumbar spine and discs, which over time can cause sciatica, spinal misalignment, and neck and shoulder pain. For the elderly, these complications not only cause discomfort, but also reduce mobility, decrease sleep quality, and increase the risk of falling when standing up or walking. When standing or walking, if the posture is hunched, the body weight is too much on one leg, or the knee is locked stiffly and the hips are misaligned, the skeletal system will bear uneven pressure, which can easily lead to knee pain, hip pain, and even cause imbalance, making elderly people prone to falling during sudden movements. So how to sit correctly without back pain or knee fatigue? First, start with a familiar chair at home. Older adults should choose a chair with a sturdy backrest, a suitable height so that both feet touch the ground, and knees bent at a 90-degree angle or slightly lower than the hips. When sitting, the upper and lower back should be kept naturally straight, neither slouched forward nor excessively arched. Shoulders need to be relaxed, avoiding raising them or pushing them forward. The head and neck should be kept straight, eyes looking straight ahead or slightly downward, absolutely not leaning too close to the screen or reading materials. A very useful tip is to use a thin pillow placed at the lower back to help maintain the natural physiological curve of the spine. Both legs should be placed parallel, not crossed or left dangling. If sitting for more than 30,045 minutes, stand up, walk around, or perform some stretching and gentle twisting movements to keep the joints moving and improve blood circulation. For elderly people who often have difficulty standing up, choose a chair with armrests to reduce pressure on the knees and make it easier to lift themselves up when needing to move. Common mistakes to avoid when sitting include sitting too deep into a chair without back support, sitting leaning to one side, or resting your arm unevenly, using a chair that is too soft, causing the body to sink and the spine to curve abnormally. Especially, sitting in one position for too long without moving will cause joints to become stiff, muscles to weaken gradually, and significantly increase the risk of back pain and leg numbness. For standing posture, older adults should keep their heads slightly raised, eyes looking straight ahead to maintain the natural physiological curves of the neck and back. Shoulders should be relaxed, not hunched forward. Chest slightly open without overextending. Keep the back straight. Gently tighten the abdomen to activate the core muscles, better supporting the spine. When standing, body weight should be evenly distributed on both feet, avoiding putting all the weight on one side or standing on tiptoes. Knees should be slightly bent, not locked, as locking can cause thigh muscle tension and dizziness, especially when standing for a long time. Choosing footwear is also very important. You should use flat-soled shoes that fit snugly and have good cushioning to protect the joints and prevent slipping and falling. Minimize the use of high heels, flip-flops, or backless sandals. A small tip is to practice standing in front of a mirror for about 5 minutes each day to observe and adjust your posture, gradually forming the habit of standing correctly, reducing the risk of spinal curvature and loss of balance. When walking, a great activity that helps maintain musculoskeletal, cardiovascular, and respiratory health. Correct posture also plays a decisive role. Keep your eyes looking straight ahead about 2-3 meters, your chin parallel to the ground, and avoid looking down at your feet for too long. Take moderate steps, neither too long nor dragging your feet on the ground. When stepping, let your heel touch the ground first, then gradually shift to the sole of your foot, and finally to your toes. Swing your arms gently in rhythm with your steps, without tensing up or putting your hands in your pockets. Regulate your breathing evenly, avoiding holding your breath while walking. Older adults should choose to walk on flat surfaces with few obstacles, avoiding steep, slippery terrain or areas with many barriers. Wearing comfortable walking shoes that fit well and have good cushioning will help reduce pressure on the joints and limit injuries. If there is a history of balance loss or previous falls, consider using a walking stick to support safer movement. To maintain correct posture, in addition to making adjustments in daily activities, older adults should practice some gentle exercises that help increase the flexibility of muscle groups and improve motor control. For example, shoulder and upper back stretching exercises help keep a straight posture when sitting. Light knee lifts in place help improve balance, and neck, shoulder, and hip rotations each morning help joints move more flexibly. The exercise standing straight against the wall is very simple but effective. Stand close to the wall, keep the head, shoulders, hips, and heels all touching the wall for about 2 minutes, which helps re-establish the sense of correct posture. Just spend 15 to 20 minutes each day, divided into 2 sessions in the morning and afternoon. These exercises will help older adults maintain the flexibility and health of their musculoskeletal system, while also improving their awareness of their own posture. However, be alert to warning signs of prolonged poor posture: back pain, neck pain, frequent neck fatigue, uneven shoulders, one side lower than the other, head tilted down, difficulty looking straight ahead, knee or foot pain when walking, easy loss of balance when turning or standing for a long time. If you experience these symptoms, do not hesitate to visit a musculoskeletal specialist or rehabilitation center for timely consultation and treatment. A correct posture, whether sitting, standing, or walking, is the golden key that helps older adults live happily, healthily, and confidently enjoy every moment of life. It is not a major change, but just small daily adjustments. Sitting up straight, relaxing the shoulders, placing the feet firmly, standing with even weight, walking steadily. Never underestimate the power of good habits, because keep your back straight today, step firmly tomorrow. Remind your relatives, friends, especially the elderly around you, about the importance of proper posture, because just one slip or fall can have consequences lasting for months, or even affect the rest of their lives. Be persistent in practicing, patient in adjusting, and always proactively listen to your body. Health is an invaluable asset that everyone wishes to preserve for a long time. Maintaining correct posture is one of the simplest and most cost-effective investments that brings the most sustainable benefits for the bones and joints, for flexibility, and for confidence and proactiveness in every step of old age. If you find this knowledge useful, don't hesitate to share it with your family and friends, and together build a community of healthy, proactive elderly people every day. Remember, posture is the foundation of health. Keep your back straight, head held high, and steps steady. You are in control of your aging, giving yourself the chance to live happily, healthily, and fully every day.